What did I think of season one of One Born? I thought it was very well done. I wasn't quite sure what to expect. I was there when the Lifetime people were there for maternity ward, and that kind of followed the doctors around. This I thought was a lot more interesting because it followed the patients around, and the doctors were more a tangential part of it. And watching the shows, I thought they were very well done. I thought it was really tasteful, and a lot of the episodes were actually very moving, and it kind of reminded me of when my kids were born, just watching people go through that. So I thought it was a very well done show. Taking a step back was weird because a lot of that stuff, I know what happens, but I'm not there for it. So, things that patients say to their husbands or to the nurses about the doctors or about the process that they maybe wouldn't necessarily say to me were pretty enlightening because, you don't know about that kind of stuff because you're mostly, off doing something else or on the phone talking to them and you don't get to see that. So that was interesting. And the funny thing was just seeing how well the nurses interacted with the patients, which you knew that they were the patient's advocate, you knew they were the patient's friend, but you didn't get to see that kind of interaction because you're not a fly on the wall in the room. And it's almost like as soon as the doctor gets there, the dynamic changes a little bit. So you never got to see that kind of collegiality between the patient and the nurse, and you understood how important that was to have. The fact that Riverside was chosen for the show impresses me, but doesn't necessarily surprise me. This is where I trained, this is where I did my residency, this is where I've been working since I got out of medical school. And the people at Riverside are top-notch. The care provided is second to none. And it does not surprise me one bit that it was chosen because of how good everyone on that unit is, because of how good everyone in that hospital is, from the minute you walk in the door to the person who cleans the room to the person who delivers your baby. It doesn't matter. Everybody's there for one purpose, and that's to make sure that patients are taken care of and that you're doing a good job providing health care for the people of the city. I think it's a tremendous honor, and I'm proud to be part of it. It did instill a lot of pride in me watching the people I work with every day do the things they normally do. I keep telling people, the greatest thing about this show is that it shows everybody in the country all of the amazing things that happen every day on that unit at Riverside because, they say every birth is a miracle, but they don't understand all of the work that goes into making those miracles reality. And, these women who are on that unit, these doctors who are on that unit, everybody is very dedicated. It's not just a job to them. It's a calling. It's a career. It's something that they take pride in, and it shows everyone just how amazing everyone there is, and what a wonderful unit and what a wonderful system is in place to make sure that everything